Not sure why that is. Let me go ahead and hop off, and then we'll just go straight to the schedule. Thanks, Andrea.
Okay, perfect.
Okay, thanks.
Okay.
Okay, so are you guys able to hear me without the split screen, or is there still a sound issue? Can you hear me? No? All right, so if you can hear me, my name is Tavra Francis. I'm the publisher of Bergen in Color. Okay, good. Now we're late, which I tried to avoid, but that's fine. It's all tech. So just really quickly as we start this chat for today, I just want to give a shout out to all of our hospitals and medical staff. As you know, here in New Jersey, everybody's under a mandatory order to stay home except for essential staff. So just shout out to all of the nurses, doctors, techs, environmental personnel, everybody, staff at Holy Name Hospital in Teaneck, in Hackensack Hospital System, Valley Health, New Bridge, New York Presbyterian Hospital, all of our pathologists and all of the people behind the scenes in the labs who are actually running the tests, our Bergen County Sheriff and law enforcement who are still, having to work and maintain order during this time. All of these small businesses who are on pause right now, just let's try to, support all of our small businesses in ways that we can. If you know that your barber, needs tips, or your hairstylist is probably lacking with tips during this time, just, send them a few dollars just to help out. I know everything is tight for a lot of people. Here in my own home, we had an emergency this weekend, and essential people, essential personnel are keeping things going. So we thank everybody at PSE&G for rescuing our situation here, and everybody who's just pitching in and helping out and doing what we can to just make sure we all get through this time. So I don't want to belabor anything right now. So let me just go ahead and get right to our call. I'm going to add Councilwoman Jervon Romney-Rice, and she is going to tell us about the situation in Teaneck. As we know, Teaneck was one of the hardest hit areas in Bergen County. So, hey, Councilwoman Rice, can you hear me?
Yes, I can.
Okay, good. We got through our sound issues.
Yes.
Okay, so thank you for joining us today. I want everybody to get to know your face. I put you on everything. Now that you're on Instagram, I'm going to do it even more.
Thank you. This is all new to me, but thank you for causing me to step up my game to the 21st century between you and my teenage son. I'm on. I was just screaming at him a minute ago, like, help, help. I'm good. I'm good.
Okay, so tell us a little bit about yourself and what the situation is in Teaneck right now.
Okay, so just as everyone else, this is our new normal for the moment, but trying to make sure that I remain calm. I'm here home with my husband. One of my teenage sons, my other two sons are actually in Jersey City. One who was mentioning that he wasn't feeling well, he was sick. So of course I'm like, take your temperature. Are you coughing? Are you running through the symptoms? Nothing like that. But we all suffer with allergies. So it just turned out to be allergies. Made him a pot of chicken soup with lots of garlic, lots of ginger, my healing soup, and ran down to Jersey City and did a drive-by, like Wakanda, no hugs, no touching,
no touch.
Here's a care package, we gotta go. So that is just a little bit about me in terms of my new normal in the midst of everything else, trying to make sure self-care is applied, taking care of my family, in addition to making sure that my community's needs are met and that all is well with my community. I just had our first teleconference call. Our council meeting was held via a council call last night. Just bringing everyone up to speed. And, our town manager, who is Dean Kaczynski, and Teaneck here is just basically holding everything down. He is our direct point of contact for information. I'm just sharing with folks to make sure you keep your information local, because it can be so overwhelming with all the national news and all the national information. For me, most importantly, is just finding out what our governor is saying. He does daily addresses. You can just Google Governor Phil Murphy, where his address is being held, so you can just be kept abreast of how you're impacted, and then making sure you stay in tune with your local town. So we've been doing calls for our township, our residents, call-ins. I posted on Facebook so other folks can actually just chime in and listen as well. We've had up to like 4,500 people on the calls, just to make sure that people are given correct and information locally, how it impacts you, like what's open, what's not open, where you can get resources in terms of food pantries or any of those basic needs. So just important to not get overwhelmed with everything that's going on and keep your information local.
Okay. In Teaneck, what can you give us a quick rundown as to what services are available? Because I know you guys run a 100% shutdown. What is available right now if people need?
Yes, so we are the first to do a whole full township self-quarantine. So all of our food and essential services are still open. As a matter of fact, I just opened up an email with an executive order of things that were added to essential services. So for instance, mobile phone have been added back. Bicycle shops have been added back for people who are saying that, they didn't have cars and transportation, bike shops so that they can get their bicycle repaired. But our local businesses, and especially in terms of restaurants, are available for takeout. So those that can afford to still remain open, please, important to support your local businesses. Call in, do takeout orders, because we want to support our local businesses, particularly our Black-owned businesses, how we know that often they struggle in general. So during this time, I'm sure that they're hard hit. So that's really important to make sure that we can support our local businesses. And, in terms of being self-quarantined, don't go out unless you have to. I've been going out just for mental health checks into the park. I take my dog out for a walk. On nice days, just, out in the yard doing some gardening work. But it's so important to social distance and self-quarantine. These are important factors, even for our young folks. It's, my brother sent me this video. He's like, teenagers that could spend 40 hours on video games, but now that they're in, time to be self-quarantined, they can't stay in the house, which right. So it's so important to self-quarantine regardless. Any age is susceptible. Just to give you some stats, we get our numbers every day. Tina currently has 166 presumptive positive cases. So those numbers are continuing to climb. We anticipate that they're going to continue to climb, especially since more people have access to testing. So we are not out of the woods yet. So unless you have to go to the grocery store, try to go at times when you don't think that it's as crowded. But basically, if the new normal is to self-quarantine and stay home. Okay.
All right, good. With the township itself, are they preparing to do any type of assistance for some of these businesses, or is that going to defer to the governor's office? How would that work?
So there is, we're keeping track of all things, making sure that people are aware of SBA loans that will become available. There's going to be FEMA resources and FEMA help available. So making sure, people should be keeping track of any expenses, undue expenses related to this. I would keep all kinds of receipts and any type of additional expenses or losses as a result. There's no specific details as of yet as to what that's going to look like, but there is information that's available through the SBA, Small Business Association, and hopefully we can share some of that information for small businesses. And I just saw that there was going to be, requests to have FEMA reimbursement for costs related to the COVID. So the other quick piece I just want to mention, there is information available through Center for Food Action. They're actually reopened today. So for folks that need immediate assistance with regard to canned food, grocery cards, utility assistance, that is available, effective today. And there is a number that folks can call. And I can share that with you, Tara, if you want to just post that.
Yeah. And then Tia, let me talk to Tia. Tia, go ahead and get this number. Go ahead, Javon.
The number is 201-569-1804. And then it says after you listen to the message to press 11. And it's important that you call first to make appointments because, typically you could call and, just show up. But right now you have to make sure that you make an appointment. The website is www.cfanj.org.
cfanj.org. And repeat the phone number one more time, please.
Sure. 201-569-1804. Again, that's 201-569-1804. And that is the number for the Center for Food Action. They're located at 192 West Demorest Avenue in Englewood, right next to St. Cecilia's Church.
Okay.
And again, as I stated, usually you could just show up, but now you have to actually make sure you make an appointment before you
Okay.
go.
Okay.
So that is a location center for food in terms of actual food, as well as resources for your utilities, things of that nature. Also, we have a church here in Teaneck, Christ Episcopal Church, that has a food pantry. They also want to make sure that people know that they're available for resources in terms of food.
Okay.
And I can give you that number as well. Would you like?
Yeah, go ahead.
It's 201 833 4502. 201 833 4502. Again, that's someplace where you would need to call first and make an appointment.
Okay, and what's the name of this one?
That is the Christ Episcopal Church Food Pantry.
Okay.
And then also Teaneck has available, it's Helping Hands Food Pantry, but they will not be open again until April 6th. They will be available for folks that have, need for food.
Okay. All right, good. Do you have any, you have 1 minute, any additional information that we can learn from as far as Teaneck is concerned, Bergen County?
Well, just on a personal note, my mantra these days is pray, spray, and obey. Just continue to pray, stay focused, spray in terms of cleaning, quarantine when you come in, if you do go out, make sure you put on your protective gear, your gloves, and then just obey what the laws are stating, quarantine, 6 feet away. That's really important. Also, just on a side note, keep your sanity. But if you have some time on your hands, do your census. That is something that is still vitally important. There's going to be a call actually tomorrow with more information about the census. So that's something that we can take on as a project, make sure that we ensure that our neighbors do their census. One last note is that Teaneck has a nonpartisan election that's coming up on May 12th, and all of that will be mail-in. So we will be having an election that'll take place for our local government, and that will all be a mail-in ballot.
Okay, good. All right. We're running behind, but thank you so much, Councilwoman Javon Romney Rice. If you're not registered to vote, make sure you're registered to vote, make sure you're able to vote, and that you do vote. And because we need people like Councilwoman Rice to be in our corner and be able to share with us what we need to know. So thank you, Javon. And
you're welcome.
I'll talk to you soon. Okay.
All right, take care. Bye-bye.
Okay, everybody. So we're going to keep going. We're running a little late. Please let me know if you can't hear me because we're having, I guess, sound issues. I'm not sure. But Councilwoman Rice shared with us a few food programs that are going on in the area. Also, Inglewood, New Jersey Recreation and the Inglewood Board of Education, they're delivering food to various middle schools. And I'll give that list later on. We're just going to go on to the next person that we're going to talk to today. Ken, I see what you're saying. Send me the information and I'll share it on the feed regarding assistance with cell phone coverage and service. I'm going to see if I can get Denise Ridley, who is the councilwoman from Jersey City, Ward A. Okay, hi Denise, how are you?
Hello, how are you?
Good, can you hear me okay?
Yes, can you hear me good?
Yes, okay. We can. Okay, awesome. So we have Councilwoman Denise Ridley from Jersey City Council, Ward A, and she's going to give us an update about what's going on in Jersey City and Hudson County with regard to this crisis.
Great, okay. I wrote a few notes for you here. So in Jersey City, we really wanted to be proactive and ahead of this. So we actually started limiting gatherings at City Hall on March 11th. We started doing reduced hours for bars and restaurants on March 12th. We have a lot of venues that hold a lot of people, particularly on our Newark Pedestrian Plaza downtown. Some of those venues have hundreds of people in them. If you go down there on a Friday, Saturday night, there's thousands of people on that pedestrian plaza. Hudson County is the most densely populated county in the state. And Jersey City is literally the next town over from Manhattan. and we see how the virus is rapidly spreading in New York City. So
Yeah.
it was important for us to try to get a handle on as much as we could.
Okay.
At first, people didn't really understand it because at that time we were hearing news of this COVID-19, but it wasn't as real for people at that point. So they thought we were being a little extreme, but since that time, you have seen that people are coming to realize that this is a very serious situation. So they appreciated those steps that we took early. There are 12 different municipalities in Hudson County. The Hudson County website has a link to each of the different townships, boroughs, and cities in Hudson County on their page. So when you go to the Hudson County website, there is COVID-19 information, and you can also access your city's site if you are not aware of what that website is. Another thing that I want to encourage people to do, and this is, there are many towns that use this system. We use it here in Jersey City. I know Newark is on that line. I'm not sure if they're updating it. I know Bayonne is, but Swift 911.
Swift 911?
Yes, Swift 911. It's an app that you can download, and then you can sign up for alerts from your town. So that's been very helpful. Here in Jersey City, we have a 24-hour hotline for people who may feel that they're experiencing some symptoms. And I'll give you that number. That is 201 547 5208. 201 547 5208. And that is 24 hours a day. And it's monitored. If you have symptoms, they'll walk you through the steps, tell you what to do next. So that's been very helpful. We have drive-through testing in Hudson County now at Hudson Regional Hospital in Secaucus. We're working to see if maybe we can get more testing, preferably in Jersey City. But as you know, right now, tests seem to be pretty limited. So we're asking residents that please to make sure that you are displaying symptoms. We do not want to waste any tests. That's important.
Yeah, from what I gather from the Hudson Regional site, you have to have a prescription as well to be able to test there, right? All right, so make sure you have a prescription, you have symptoms, your doctor has told you to go get tested.
Yes, and if you have symptoms, please do not show up at the emergency room right away. Please call that hotline so they can instruct you what to do next. One of our area hospitals, Christ Hospital, has set up screening outside of the emergency room. So when people are coming to the emergency room, they are first screened. And then if they're displaying any symptoms, they are let in through a separate entrance. So they are trying to take additional steps to make sure that they don't increase the spread by people just walking into crowded emergency rooms.
We just got a question saying, what if you're exposed, or let's see, what if you were in contact with someone? So again, unless you have symptoms, they ask that you isolate yourself, but also don't go for testing unless you are symptomatic and you have spoken to your primary care physician, and then that person will prescribe that you go and get tested.
Yes, definitely. Call your doctor. If you're in Jersey City, feel free to call that hotline. If you're not, call your primary care doctor. Let them know that you think you've been exposed, and let them know if you have any symptoms, and they can advise you what to do from there.
So what is the tone like in Jersey City right now, especially in your area?
You know, it's difficult because Jersey City is such a busy place. So there are people out and moving around, but we're trying to stick to the social distancing. So all city parks are closed. County parks are open, but playgrounds, tennis courts, etc. are closed. State parks are open. So there is opportunities for people to get out. And what I've been telling people is, get your daily dose of vitamin D, right? Get some sunlight. Don't sit in the house and go stir crazy, but please make sure you're social distancing. If you want to go to the park, that's fine. But, you know, stay away from others outside of your immediate family. If
Yeah.
you have a backyard, please utilize your backyard. If you have a front porch, go sit on the porch. We've had some decent weather lately. So on nice days, I think tomorrow might be a little nicer than today. Make sure you get out. And if you have kids especially, let them run around in the front yard or the backyard, or, you know, take a walk around the block. But please remember to social distance yourself from other people.
Okay, good. Do you have any other information that we need to know from Jersey City
As of
area?
right now, Jersey City, as of today, we have 101 cases positive.
Oh, okay. All right. So, all right. And where can we be in contact with you specifically?
With me, you can find me on here on IG. I am D Ridley. I've been posting updates there. I'm also on Facebook, Denise Ridley. If you want to shoot me an email, you can. That's D Ridley, DRIDLEY at jcnj.org.
Okay. Thank you, Councilwoman Ridley. I appreciate your time. And this is one of the reasons, again, why it's so important that we have people like us in government so that we can have access when we need to know what's going on. So thank you for all that you do for Hudson County and Jersey City. And, you know, just, you know, let's keep this going.
No problem. Thank you for having me.
No problem. Take care. Okay, we're going to keep it going. Thank you to Councilwoman Ridley. Again, if you have questions, this video will be posted on our YouTube channel, Bergen in Color. So you can go back and watch the past video from last week and one from this week as well. So we're going to keep moving forward. We're going to talk, I see some questions about business relief programs. So really quickly, there's going to be another live coming up in collaboration with Lakeland Bank and the SBA that I'm going to probably do and announce shortly regarding business relief. But we're going to talk to a local businesswoman regarding just her experience as a small business owner in New Jersey, and some tips to help us try to maintain our businesses as well. So this is Aisha Taylor Issa, and she is the founder and CEO of the Sisters in Business Expo. She is my actual friend since we were actual children. I was an adult, she was a child, but we went to college together. And she came when she was 12. And so, Aisha has built this massive brand called the Sisters in Business Expo. It is a multi-city tour that celebrates entrepreneurial women of color, for which I'm the marketing coordinator. And so you see her on my page often. Aisha's going to, I see your house plant. Okay, good.
I know, I was just pulling up my my tripod.
Okay, so Aisha's going to talk to us about small businesses and some things we need to know about how to cope during this time. Thanks for joining us.
Hi. Hello, everyone. Thank you, Tevra, for having me. Congratulations to you for this wonderful platform that you've built to help keep us all connected and informed, and for the wonderful work you do with the Sisters in Business Expo. Hi, everyone. We are here at the Sisters in Business Expo, right in there with the trenches, with fellow small business owners who have been impacted significantly by this pandemic. And so during this time, we are coming from a position of we know how you feel because we're feeling it too, but at the same time also trying to provide as much resources, information and inspiration that we possibly can to keep our community informed and motivated and educated. And so that is what we've been doing over these last few weeks. We ourselves had to reschedule the kickoff for our 2020 tour, which was initially supposed to be held in Newark, New Jersey next week. And now will be held in September 18th and 19th. And so we still have 4 other tour dates that at this point are still on schedule. And we are just continuing to closely monitor the progress of this pandemic, praying and hoping for a quick resolution, or at least some return to normalcy, so that we don't have to reschedule any additional tour stops. But We're just going to take it one day at a time and see how that's going. We do want folks to know that we are still accessible and on and operating. So there are still a few vendor spaces left for the Newark, New Jersey Expo, which is now in September. Most categories are sold out, but that information is available on our website, as well as sponsorship opportunities, partnership opportunities, and things like that. And so, yes, we definitely still have that going on. The Newark experience this year was a 2-day experience, and it still will be. It will be September 18th and 19th, and that Friday is when we will host our Sisters in Business University live conference and pitch competition. We are very grateful and blessed that all of our keynote speakers were available and will be with us in September. And so, so we encourage you all to still go ahead and get your tickets and plan to be a part of that, because it's really going to be amazing. And then, go ahead.
Okay, so what programs, I know we have some programs going on through the Sisters in Business University. Can you talk a little bit about that and opportunities for people to learn while we're all quarantined?
Absolutely. So our Sisters in Business University is our teaching and training arm of the brand, where we provide the actual resources and information that you need to scale and grow your business. Generally, we have those course offerings once a month, but in light of this pandemic and everyone being quarantined, we decided to put together a series of free courses that will be happening over the next couple of weeks. And they actually begin tomorrow. On March 26th, we'll be co-hosting a course with the Grow with Google and Google Digital Coaches program on how you can coach your team to success, which will be followed with a founders chat with Angelina Darasaur, who is the national digital coach for Grow with Google. And so that is happening tomorrow, March 26th. And we have another one on Friday, March 27th, which is tax tips during tough times, with our very own sponsor, Alicia Harvey of Distinct Tax Consulting. She is a tax guru. She knows all things tax for small business. She herself has been sending out daily almost updates for small businesses as the leadership and administration of this country announces different changes to tax impacts. And so it's really important that you have that information to know how this is going to impact you and your small business, and then just some general tax tips for small businesses. So that's going to be Friday at 1 o'clock. And then next Thursday, April 2nd, we'll be hosting Digital Marketing for Modern Entrepreneurs, how you can strategies for reaching and growing your audience. While we're in this quote unquote downtime, as much as we can, we want to try and make the best of it. You don't want to lose your momentum with your audience. Sales might be down, but that doesn't mean that your engagement has to be down. Your marketing doesn't have to be down. And so we're going to be led by LaShawn Dreer, who is the leader of Black Women Hustle and a marketing expert herself, who's going to be sharing with us some tips on our digital marketing. And then we have two others that are going to be announced later this week. So we encourage you to of course, follow our page, join our mailing list, and you can register for each of these courses. They are all free, but you do have to register for each one, and you can register for all of them. We would love to have you, and that information is on our website at sistersinbusinessexpo.com/SIBU.
Okay, so really quickly with events and cancellations and all of that stuff, we see that a lot of major events are closing. What do you think is going to be the moving forward, the protocols for event-based businesses going forward?
Yeah, well, first and foremost, you want to be sure that you have the proper insurances in place that cover you in case of challenges like this. And you also want to have clear communication with your audience. So in any of your signups, your registration, your ticket pages and things like that, you want to always keep yourself, covered. Because we can't plan for things like this, so it's best to just have the information there so that in case it does happen, you are covered. And so that's something that's really going to be important. I think a lot of people probably learned a tough lesson this time around by not having the proper insurances or not having insurance that covered things like this. And so you want to be sure you have that in place. And then as much as you can, try to have a contingency plan. I realize that some people have no choice, or they may have only had the option to cancel. As much as possible, we are in the business of postponement, not cancellation, because we realize how important this work is for our community, how much our small businesses rely on this platform to be able to showcase and grow their businesses. And so whenever we can, we try not to have to cancel. And so, be in communication with your event spaces about possible, rain dates or other dates that might be available that you can use in the event that some sort of tragedy or national pandemic happens. It's taught us a lot. I think it's definitely taught us a lot. And if you don't, you'd have to be a fool to not learn from this experience as someone in the event business, and to take this experience with you to make you a better planner. Okay, you got 1 minute. Tell us everything we need to know. So just a correction on the website that was posted is Sisters in Business Expo. That's SISTAHS in businessexpo.com/SIBU as in Sisters in Business University. You also can just go to our website, sibexpo.us, and click on university, and you'll see all the course information. Please register for these courses. They are free. All of our courses are not usually free, but these are, because we realize the challenging times that we're in. So we want you to learn and gain as much as you can during this time. Stay motivated, stay encouraged. We're socially distant, but we don't have to be disconnected altogether. And so as much as you can, we want to stay connected with you all. And this is one of the ways that we plan to do it, by giving you as much free education as we can. We're calling it the homeschool series, right? That kids aren't the only ones that get homeschooling. So this is our homeschooling for our sisters in business. Okay. Thanks, Aisha. Just one more quick note. Every Monday at 7 a.m., Aisha leads us in a Sisters in Business prayer cast. Go to her Instagram at SIBExpo and just see all the things we got going on. Like I said, I'm the marketing coordinator. Aisha is the founder and CEO, and she works really hard. We really want this to keep going. So there's lots going on. There's I'm drawing a blank. There's merchandise. I wanted to mention the pitch competition. The pitch competition is still on. It's going to be Friday, September 18th. The application deadline is April 15th. We are awarding over $4,500 in prizes, but the first prize is $2,500. This is a business grant. It's not an investment, so we're not taking any equity or anything in your business. But we encourage you to apply, and that information is also on our website. Just go to sibexpo.us and click on applications. The deadline is April 15th. I think someone asked about whether or not their child could participate. Just send me an email. Author Angie, you have my information, and I can further discuss that with you. But yes, the pitch competition is on. We're very excited about it, and really looking forward to being able to invest in our sisters in business. All right. Well, thanks, Aisha. And we'll talk soon. Thank you. All right. Bye-bye. Okay, we're going to keep going. So while I add our next person, let me just give a quick list of the delivery schedule for Inglewood. They are delivering breakfast and lunch for students from pre-K to 12th grade. They have the times ranging from 8 a.m. to 12 noon at JEDMS, Janice Dismas School, Rock Creek Terrace, Sheffield Apartments, Parkview Terrace, King Gardens, and Westmore Gardens. This delivery service is provided by Inglewood Recreation in partnership with the Inglewood Board of Education. And the times can vary, but it's basically between 8 a.m. and 12 noon. Most of them are 11 to 12. So if you know of somebody who needs food assistance, especially with kids being home, please let them know that there's assistance available in Inglewood for Inglewood students pre-K to grade 12.
All right, we're going to keep going. I'm going to see if I can get Dr. Lopez on. Give me just a second. And while we're waiting for her to add, we're going to answer questions at the end. Hey, Dr. Lopez.
Hello. Hi, Tebra. How are you?
I'm good. How are you?
I'm super good. I'm super happy to be here and talk to your audience.
Thank you for your time. I was just finishing a thought. So if you have questions, everybody, you can go ahead and type them in, and we'll answer them as we see them. Or if it's something that can be answered at the end, let's wait till the end and answer it then. Okay. So Dr. Davina Lopez, MD, is a pediatrician here in North Jersey, and she has a podcast, Dancing into Parenthood.
Yeah.
Right?
Yes.
And so we're going to talk with Dr. Lopez right now about some health tips and just all the things we need to know about the kids and maintaining during this time.
Yeah. So I think you've basically heard all the things that we could do, right? Everyone knows about washing your hands for 20 seconds. Everyone knows that we need to teach our kids to sneeze and cough into our arms and elbows. These are the things that they are in control of, because you have to give your children these really honest conversations and let them know what can they do right now to keep themselves healthy, because I don't want them to be panicked at home. I keep telling parents the most important thing is that you're taking care of yourself. Because you need to take care of yourself and be in a place where you are feeling calm and control of the situation, right? Because kids really mimic, what they see in their parents' behavior. And if they notice that you're not feeling in control, then they feel like things are spinning out of control, and they, they need to have a good practice for themselves of how they can keep themselves healthy, right? So, just keep reinforcing that stuff. Make sure that you're keeping the house clean, that you're sanitizing like the high touch areas. So like your faucets in the bathroom, the doorknobs, the kitchen counter, we have to just keep sanitizing all those things. I think get them involved if they can be involved, if they're old enough, like totally get them involved in all of this. Make sure they're not sharing utensils, because kids, especially siblings, they constantly do it. So just remind them that this is not the time to be doing that. Make sure everybody maybe has like a cup with their name on it or something like that. Go ahead and label water bottles so that everybody just keeps to their own stuff and, not confusing what was theirs. Okay. And then the other thing is that I think a lot of times we are forgetting even about like stuffed animals and the plushes. If you can go ahead, look at the tags. If they can be washed with like the warmest water, hot water, if it's possible, go ahead and wash them every few days. Wash the towels. Wash the sheets often. Like, we have to do this a little more often right now.
That's a good point.
Yeah, so just keep on top of those things. A lot of parents are calling me like panicked about like, do I need to wear a face mask? Does my child need to wear a face mask? Some people are like taking their kids out with face masks and gloves, even just to go outside for a walk. And that's not recommended. If your child is a healthy child and you're just going outside for a walk or to your backyard, there's no need to wear a face mask or gloves. Yes, when you come back in, like try to leave the sneakers outside and stuff like that. When you come in, make sure they wash up again. But please, that's also kind of like panicking them if you're doing that sort of thing, because they're wondering, why do I need to wear this stuff? So don't do that. Unless they're sick, then that's the reason why they should be wearing a face mask. But if they're sick, you should be calling your doctor, right? What's recommended right now, if they're having like mild or moderate symptoms, is that they actually stay home and do like the regular supportive measures that you would do, like even if they had a regular flu, right? But you will call your doctor first, and then we'll let you know if we need to see you in the office, and then we'll decide if we need to go on to further testing. Okay.
What about things like supplements, vitamin C? Like, what are your recommendations for kids for things like?
My recommendations are the same as on any other day. I want kids to stay healthy by eating healthy, okay? Number one is trying to get all your vitamins and your nutrients from your food. So this is also a great time to reinforce how important it is to eat healthy, because if you eat healthy, then you really don't have to be worried about supplements, right? So yes, I do think it's super important right now to take vitamin D because we're not outside as much, and vitamin D comes from the sun, right?
Yeah.
So I would definitely make sure that you're getting a supplement for vitamin D. If your child is not the best eater, they're like a little picky and stuff like that, yes, do a multivitamin right now. The vitamin C is always great for the winter time. And I also like things like elderberry and stuff like that. I do like having those extra protective measures. Elderberry, everybody loves it. The kids love it because it tastes really yummy, and then it has the goodies in there, right? So go ahead and do that. And another thing, if you have a child who has any chronic illness, right? These are usually kids that have like asthma, diabetes, sickle cell. Those are the kids that are more at risk for if they get sick, what do we do? So if you have a child with asthma, make sure, this is so important, that you call your pediatrician, ask them and make sure that they have refills for their medications. I want them to have their inhalers available. If they're on maintenance medicine, something like a Flovent, then I need for that child to be taking it twice a day. This is so important because we don't want them to get sick, right? So make sure that they have whichever maintenance medicines that they need to take daily at home, and make sure you have refills, because my concern is, you know, I don't want you to run out of this stuff and then it's the middle of the night and, you know, this is not right. This is a really hard time to access stuff. So I want you to make sure you're prepared. Even if your child hasn't had a symptom in like 2 years, just make sure that you have that regular inhaler that they may need if they have a cough, if they have any wheezing, any shortness of breath, anything like that. Okay? One of the other things, I know there's that rumor going around about ibuprofen. It's a rumor, guys, okay? There's nothing that I can say is backing that up. So please, yes, acetaminophen is great, so your Tylenol, but the ibuprofen so far, as far as I know, there is no study or anything saying anything like that. It's a rumor. So I don't want people to be panicked about that.
Yeah, and all of this is new information. Like, this is a very new virus, so anything coming out is, you know, is not studied yet. This is very new. So everybody's just learning as they go along. Yeah.
And, you know, just a few other things. I think, you know, staying indoors, we need to make sure that we keep ourselves sane. It's hard. I know. I've never worked from home before, and so I'm working from home. I have a 7-year-old, and my kid is a super hyperactive kid. So doing the distance learning is very stressful on top of trying to do your own work. I totally get that. This is an amazing time to take advantage of being home with your kids and having some sort of, like, you need a mindfulness activity on a daily basis. Luckily, I was practicing that like long before, but even so, like having that as part of my routine, I'm still like, yesterday was a hard day for us. So please, if you are religious, pray, bring out the Bible. Let's talk about the stories, because there's so much to learn, you know. If you're not religious, if you're spiritual, maybe do some breathing exercises with your children. YouTube has so many great resources. I love Cosmic Kids because it also incorporates some movement, and kids usually need some sort of movement. Indoor Recess is great. Go Noodle is awesome. They also do some like breathing exercises, and they do the physical activities. So, you know, keep your kids busy. And if you have older kids, like if you have, you know, multiple kids, the older kids can help out with the younger kids. So get them involved and let them know that you need their help right now.
Good. Okay. Any specific words of encouragement for those in the the special needs community, those who are you talked about asthma, you talked about pre-existing conditions, but those who are with special needs children, do you have any information that would be useful for them as well?
I think right now the communities are being so supportive, and the physicians are trying to come up with the best plans for their patients. So I think you should, number one, have a medical home where you can reach out to them and they can form a plan, because I think every child is so unique. You need to know your patients really well. So this is an important time to have a really good relationship with your doctor, keep in touch with them. Me, for example, I'm reaching out to all of my asthmatics every day just to see how they're doing, making sure that they have what they need, and letting them know that I'm here for them. Like, don't think that you're at home by yourself, because you're not. Like right now, the most wonderful thing that's coming out of all of this is that we are forming like these really strong supportive communities. You know, yes, the healthcare workers maybe have slowed down a little bit if we're in private practice because we're trying not to bring people in, but we are available through telemedicine. We are available through phone calls. Don't be afraid to reach out to us because we want to help. Like, I love what I do. I want to make sure you're healthy because we're going to all get through this. And I want people to stay positive because if you're negative during this time, that also affects your immune system. So I want you to really, like, just remember, we will get through this. We've gone through so many other things. We're going to get through this too, you know? So keep your social distancing, you know, that's really one of the most important things right now. But we are here for you 100%, okay? And don't feel isolated at home because you're not. Have the important phone numbers that you need. Specialists are available, and so are your primary practitioners, okay?
Okay. Thank you so much, Dr. Lopez. Where can we find you? And
so you can find me on Instagram. It's Dr. Divina Lopez. You can find me on my website. It's drdivinalopez.com. And I'm also coming out. I have another Instagram live today. If you want some mindfulness for your kids at 8:30 tonight, I'm going to tell you tips. And I'm also coming out with a new program for new parents because I know that they are so afraid to go out with their newborns. Where I'll be doing some one-on-one coaching with them, and then basically like giving you the manual that babies never come with. So I've been working on this for a little while, and this is just the right time to release it.
Okay, great. Thank you so much, Dr. Lopez, and we'll be in touch.
Thank you, Deborah.
Thank you so much.
Okay, bye.
So we're going to keep going. Thank you to Dr. Lopez. If you guys have questions, just go ahead and put it in the comments. We have coming up, and while I add her, we have Chef Kim of Laughter Travels Gourmet. And Chef Kim, if you go to her page at Laughter Travels Gourmet, everything on her page looks like it's straight out of a magazine. One day after all of this clears, I want you to come and serve me one of those octopus plates that you have.
I got you covered. That's what I do.
Okay, good. So Chef Kim Mills, she is a certified chef, personal chef. You'll be able to tell this better than I can, but basically she has the most amazing tips on how to make your food stretch, make your storage make sense, and do the most with what you have in your cupboards and your fridge right now. So
exactly.
Go ahead and school us on what we need to do in the kitchen.
So one of the things, hi, how's everyone doing? So just like so many other people, I have asthma myself. So I come from a place of when it comes to food, in terms of food as being healthy as well as tasty. And I think through this experience, I think more people need to realize that healthy food doesn't have to mean tasteless food. You know, so that's one of the things that I'm also coming from. And I also have parents who are seniors. My parents are in their 80s. So a lot of the tips that I come from are also coming from a place of, you know, food is love, food is nourishment, and especially right now is being methodical and doing a little more thinking in terms of how we look at our food and how, you know, one of the things that I was looking at in terms of the grocery store, yes, the grocery store is still open, it's still available, but you still should be limiting, you know, the time at the grocery store to no more than about one time a week. Yeah. Because every time you go, you are still exposing yourself. You know, so one of the things that I definitely talk about is shop with a list, right? So have a game. If you shop with a list, it's going to do two things, right? It's going to give you a game plan as to what you need to cook, and it's also going to keep you on budget. You know, right now, a lot of us don't know how long this is going to go for. You know, so the fact that you shop with a list, it's giving you a game plan, right? Going into the grocery store, for a lot of people, it can be a little overwhelming. So even if you don't go to the grocery store, if you're getting groceries delivered, it allows you to really plan ahead. So that's going to be my first tip, is shop with a list, right? The second thing that I'm going to say is buy foods that serve multi-purposes, right? So if you're not a person who likes leftovers, do not make the giant pan of lasagna because you're like, okay, it's economical. I now have servings for 12.
I feel
and now,
seen.
right, you're at day 2
Mm-hmm.
and you're just like, I no longer want to eat this.
Mm-hmm.
You know,
Mm-hmm.
I think the fact that if you want to buy foods that have multi-purposes. So for example, buy a food that can serve as a snack food, as a main course, as well as a dessert. So
and what kind of food would that be?
So for example, if I have an apple, right? My apple can be a snack food. I can eat that with peanut butter. So it's a snack food. It's a healthy snack food. It's providing me with protein as well as sugar. So that's one component. But if I have chicken in my fridge, like a lot of people do, or if you have pork, if you bake it, it goes very well with a savory dish, right?
Okay.
It's also allowing you to step outside of your box, right? In terms of what you know about food. Another component, right? If you buy bread, right? If you typically buy a loaf of bread, take half of that loaf and freeze it, right? Because bread is actually one of those few things that freezes really well. If you freeze bread, you can use it for several different ways, right? I can use bread for sandwiches. I can when I've toasted the bread, I can cut it in cubes, and now I have stuffing. I add that stuffing with some eggs, and now I have a remixed brunch. So you still are having brunch at home. It's about multi-purposing your food, right?
Okay.
The other thing is when you buy your proteins, right? I still, one of my biggest concerns is food waste right now. So if you go to my page, if you go to Laughter Travels Gourmet, I have actually been posting tips. I've been telling people about proper food storage. Just because you've gone to the grocery store, does that mean that the food that you've cooked is going to last for a week and a half, right?
Yeah.
So I think, if you keep your immune system healthy by properly storing your food, whether that's in the refrigerator, whether that's in the freezer, you also are keeping yourself healthy. At this point now, you don't want to be taxed with food poisoning and going to the hospital. So that's definitely something that I look at as well. If you decide to buy proteins in bulk, right? You've gone to Costco, because I've been seeing the lines. Portion out your proteins. Create your own freezer meals. That's one of the other tips that I've really talked about and that means, it's going to take a little more time in the beginning, right? In terms of portioning it out. This is also something where you can get your kids involved, right? I think as adults, if we take the mystery out of food and children understand food, one of the things I really noticed was when I went overseas, I did an intensive in France, and children from very young age, they're learning about food. They're learning about sustainability. And that's something that we don't necessarily do here in the States. We don't necessarily really teach our kids about food. So get your kids involved, right? If you get them involved, it also makes it a family activity.
And one more thing to fill the day.
One more thing to fill the day, right?
So days are getting longer and longer.
Exactly, right? So let's say you've portioned out those proteins. Don't forget to label them. So you've portioned them out. Label them with the date and what it is. You don't want mystery meat, right?
No.
So those are some things to think about. And one of the things that the doctor just discussed was immune boosting foods. Your food is wealth, right? You can, if you're shopping the outer portion of the grocery store, you're buying fresh produce, you're buying fresh fruits, fresh vegetables. I went into the grocery store several weeks ago, and one of the things that I noticed was when I saw the freezer aisle, it literally looked like it was decimated. And I think a lot of people were extremely like, okay, let me get frozen foods and let me get canned fruits. But one of the things I even tell my students is when you cannot buy fresh, buy frozen. Because when you buy frozen, typically your frozen foods are on par in terms of pricing and what you see with canned goods. By freezing it, you also are allowing them to stay longer and it's fresher. A lot of times when we buy canned goods, we're buying food that's high in sodium. Sodium, right? Because it has to have a preservative. So when you've taken things into your own hands, you're also helping your family stay healthy. You know,
Yeah.
so one of the things the doctor discussed was vitamin C foods, right? We all know about oranges. We all know about lemons. We know about ginger. But, you know, let's not forget about peppers, red, yellow, green peppers, your green foods, right? Broccoli, spinach. If you eat your colors, if you eat your rainbow, you're also allowing yourself to get different vitamins because each thing provides something different.
Good. Yeah.
You know?
So the other day I was at Whole Foods and I was surprised at how intact the green section was. The actual like green grocery section was like pretty much spotless. Everything was full, you know.
Yes.
And all of the like chips were decimated, like crackers.
Yes.
All of the things that we really don't need. So shopping the perimeter is probably the best way to stay healthy. But I don't know if people got that memo.
Yeah, so, I don't think so, because I think a lot of times when we hear the news tells us buy food that is shelf stable, right?
Yeah.
And foods, you know, food that is shelf stable, people automatically think, okay, I'm going to get my tuna because that's long term, right? I'm going to get pasta because that's long term. But people don't, sometimes we have to read in between the messages and take it to another level, right? We have to do some research. We have to figure out how we're going to make our food stable, right? One of the things that I'm trying to deal with as well is having seniors that are used to being on the go, you know, and having to, the last time I went to the grocery store, which is now about a week and a half ago, you know, so I think one of the things that's been interesting is when I posted the dish that you discussed that had the octopus, people were like, you got octopus?
Octopus.
What you doing?
Like,
and one of the things that I have always done is I buy on sale. So when things are on sale, I pick it up. If fish is on sale, I pick it up. When chicken's on sale, I buy a whole chicken, right? Yeah. Because with a whole chicken, I can do so much more with it. I can cut it into pieces. I can use the bones for stock, right? I can create my own chicken breast. And even if you're not a chef, sometimes we got to go back to what grandma did, right?
Yeah.
In terms of how grandma cooks.
So we're going to wrap up because we're running behind. But Kim, always, I'm fascinated. Where can we find you? Where can people get more information from Laughter Travels Gourmet?
Definitely. So please look out for me here on Instagram at Laughter Travels Gourmet, on Facebook at Laughter Travels Gourmet LLC. On Tuesdays, I do Kitchen Table Talk Tuesdays. I answer any of your culinary questions. I'm also available privately once this breaks to come in.
Listen, I got a new stove too. I'll tell you that story, but I got a brand new stove waiting for you. So
perfect. Yes. I do kitchen organization. I do customized meal plans for special diets, whether that's a renal diet, HCG, weight loss. I also help you make sure that food is part of your lifestyle and not a burden.
Okay. Thank you so much, Kim, and we'll be in touch.
Thanks a lot. Please be safe and be well.
You too. Thanks.
Bye.
Bye. Okay, so that was good information from Chef Kim. Go to her page, Laughter Travels Gourmet, and we're gonna go right on into our last speaker today, who is my girl, Miss Andrea Jackson, and she is while we're waiting for her to add on. Hey, girl.
Hi, Tabra. How are you?
I'm good. So I was just giving you a brief intro. Andrea is a motivational speaker. She is a lifestyle coach. She is a podcaster. She is a survivor. She is a New Yorker. I think we're probably going to be cousins once we do our Ancestry.com. So
probably.
Let's go ahead and Jamaicans represent. So
yes, we do.
So we're going to go ahead and talk to Andrea right now about mentally coping through traumatic changes. I put that as a generic, but really I just want you to like bring us home and kind of give us the information that we need to move forward, you know, a little bit stronger than what we are now.
Well, I'll say this. First of all, I'm a lifestyle coach. I mostly coach women. I help women, those that coach and confront post-trauma. And that has inhibited their growth. So past traumas can affect our relationships, your
So we're going to get back to where we were before we cut off. Give me just a second. Andrea. Okay, give us just a second. We'll be back on. Okay, sorry about that. It cut me off.
That's okay.
I feel like D-Nice the other night when it kept cutting off when he was almost at 100,000.
It's technology, but like I was saying, I'm a life coach. I help women who's dealing with trauma and past trauma, how to get past it, because sometimes it will affect us in our professional life, in our everyday life, with our children, with our relationships. So at this time, I would like this, in light of COVID-19, this is the perfect time to self-reflect. Many of us, for the first time, have been forced to be alone with our own thoughts. And that can be very scary for us, because no matter what your lifestyle is, we as a goal-oriented and social beings are constantly on the go, go, go. So when we're forced to stop, it can be quite traumatic and very overwhelming for women, for men, for children. They're going through it with us. Those of you who have just tuned in, I want you to walk away with some tangible advice. Watching the news before bed is a no-no. Try to watch an hour of news in the morning before you start your day with the state that you live in. Sometimes looking at other countries and what they're going through is horrible for our mental health, especially where we are today. So you have to take that seriously. Watch the news at the state that you live in for an hour to see what's going on, so you are staying abreast to what's happening. Only dedicate an hour. I find a lot of people is on social media for hours at a time, and all it's doing is stressing you out. Let's not do that. Don't rush this process. This is a situation, unfortunate as it is a demonstration of how necessary patience is. We best not rush the doctors, the scientists, and the government officials who are carrying us through this epidemic, just as you best not rush yourself through whatever journey you are currently on right now. It's so important. Acknowledge your feelings. Acknowledge where you are today and what you're facing today. This is uncharted territory. None of this in this time is used to something like this. So I say, take this moment to be still. Take this time to look at where you are and where you're headed. A lot of planning is happening now, and this is what you should be doing with your time. Planning what's your next step. Another thing that I really think is valid is recording yourself with a recorder. I want all of you, I've been doing it for 2 decades now, and I do it a lot with my clients. I want you to pick up your recorder when you're feeling down, whatever emotion you're going through, record it. And I don't want anyone to play it now. When this epidemic is over, I want you to play it then. Then you will see your mistakes. Then you will see what worked. And then you will know how to handle it the next time you're faced with something like this. That is my suggestion to all of you today. A lot of us is not used to being at home with our children full time, our families, our mates, or whoever. And it's a challenge for all of us because we're all on top of each other. Allow people to be in the space that they're in right now. Let's be respectful. Let's be compassionate and empathetic at this time. And let's think of our neighbors outside of our home. And let's also pray for the people that have lost their jobs, that don't know where their next meal is coming from. In any way that we could help and assist, let's do it.
Yeah, earlier I was saying, if you have, like I said, my hairdresser, I know they appreciate tips, but we're not doing hair right now. We're not doing barbershops. We're not doing all of the things that we take for granted as part of our regular routine is done for now. So, when you think about like all of the people who rely on tips and services, I have a couple of friends who are masseuses who are not able to work. You can't go into people's homes. So what advice for people in those situations do you have for them? Like, what should they be doing right now? Because they're kind of
my advice
if they're going to make it.
My advice to them, Tevra, would be this. You have those loyal clients and customers that have been with you through so much. Those are the people that you need to lean on because you know who they are. And trust me, they wouldn't think twice to help you out. I got to tell you, there's a lot of people that I have looked out for because I know that I can do it at this moment. And I know if I was in that situation that they would do it for me. So you're not going to ask people that you know are not in that position, but you should ask those people that are in position and that have been your loyal clients.
And then so also for those of us who my husband, being frank, he's essential staff at a hospital. How do you talk to people like us, the spouses of, and the families of, I know of colleagues who are self-quarantining themselves because they're right there on the front lines directly, and they're separated from their children, their families. Like, what advice do you have for people in those situations, including me?
I think this is a time that you send those love text messages to your husband. Those are the times that you reach out to them on the phone call and tell them how much you appreciate what they're sacrificing, but somebody's got to do it. And this is the time for you to be compassionate and empathetic to what they're going through, because they're going through their mental trauma too. Seeing people dying, seeing people sick, some people are coming to them at bad stages, and how that's affecting them. Talk to them. They want to see how concerned you are about them. And when they do come home, that's the time where the kids got to ease up a bit. That's the time we have to ease up a bit and be more loving to them. And whatever we're going through, unfortunately, we have to put it on the back burner because they're out there sacrificing themselves. So this is the time that you show up and show out for your family.
Yeah. Yeah. So as a New Yorker, you're in the city right now. What is the town like for you and for your neighbors there?
Well, I got to tell you, Harlem is quiet. Uptown on 128th between Lenox and 5th. And I'm just telling you right now, Whole Foods have a line outside. They're only letting in 5 people at a time. Really? The same thing with our grocery stores and Trader Joe's. I have to tell you, I have not seen NYPD enforced the way they are. There's a cop car in every corner. Okay. The National Guard is out here, and people are really listening, and they're staying in.
Good.
They're staying in.
Good. So tell us about your podcast, your services. Like, what should we know about Andrea Jackson?
Well, right now I'm giving my services free for the month of March and April. So anyone who needs mental health, please reach out to me. You can find me at andreapjackson.com. I have a podcast that's doing really well, and it's a real life.
I listen.
It's the truth till it hurts. And sometimes I don't have the best delivery, but I'm going to give you the truth.
No, that's why we tune in for tough love.
It's called Our Mirrors Reflections. You can find that on iTunes. You can find it on where am I?
Everywhere you listen to podcasts.
Spotify. Spotify. You can find me on anything. And if you need to find me, you can find me on Instagram, Andrea P. Jackson _ and please follow me there. But anyone who is going through something mentally and emotionally, and you feel it's just too much trauma going on, call me. You can reach out to me. You can find me on Instagram. Everything is confidential. This is the time we need to lead on each other without judgment.
Okay. And then also, what, for, our last point, what words of encouragement do you have for us to, as we hopefully get towards the other side of this?
I will say this to everyone. Everyone has faced adversity. And some of us have faced worse adversity than this pandemic. And that's just true. Dig deep back into that and ask yourself, how did I get past that? And if you were able to get past that adversity, this is no different. You need to just dig deep and grab those tools, because that's where we are right now. That's what I would say. Because all of us have faced adversity at some time and point in our life outside of this. Yeah.
And, a lot of the lessons that we learned going through adversity at various points of our life are what, those tools are being able to help us today. We talked to Chef Kim just now about making food stretch. I mean, who hasn't, go back to ramen noodle life. Like, how many times do you have to repurpose, basic foods to make it stretch longer? So, a lot of the times we can't look at adversity as only a bad thing. It was a lesson to help us, face whatever challenges we'll have in the future, this being one of those challenges. Because I know everybody's coming out of this a totally different person than how we went in.
I think we're all coming out of this humble.
Yes, very humble.
Learning to save and put away for a rainy day. Yeah, this is a rainy day that has affected everyone in this world, and
a rainy downpour. Yeah,
and this is the time to reflect and say, what did I do wrong then, and what I'm not going to do wrong today, and what I won't do wrong tomorrow. Let us self-reflect today. It's really
and what important. Is truly important is living this lifestyle important, or is it being able to, when the stuff goes down, to be able to maintain basic, functioning of your home, is that more important,
Yep.
A lot of us are getting a real wake-up call with all this because you can't eat your Chanel bag.
That's right.
You can't, so it's like, okay.
How many
so
red bottoms do you want to have?
Exactly, because you can't fry those up. Chef Kim is good, but she's not that good. So you have to really take stock of what led us to this place. Bio issues aside, like financially, how are we going to prepare our homes for another situation like this? Because it can happen again.
I said, let this reset be a reflect for all of us.
Exactly. Well,
Tebra, what you're doing is amazing.
Oh.
I really, really appreciate it. And the love that you're showing all women and giving them a platform to speak and speak their truth and show what their craft is. It's amazing what you're doing. And I really appreciate it, especially at a time like this when sometimes, we're so used to seeing each other in the flesh. And now this is the only way of connecting. And so thank you for giving me the platform to even speak and share what I do.
No problem. We'll be back in touch and working together when everything calms down. We could actually do some things in person. But thank you so much for your time.
Thank you, Tebra.
We'll be in touch.
Okay.
Well, take
Bye.
care.
Be well.
Okay. So as we conclude for today, I'm going to try and do another one of these again next week. We're going to try and have a new set of professionals on here. I want to get some of our elected officials, but I know everybody's super busy. So I thank everybody for their time. I thank you for joining us today. Thank you to Councilwoman Rice of Teaneck City Council. Thank you to Councilwoman Ridley of Jersey City Council Ward A. Thank you to Aisha Taylor Issa of the Sisters in Business Expo. Thank you to Dr. Davina Lopez, pediatrician. Thank you to Chef Kim Mills of Laughter Travels Gourmet. And thank you to Andrea P. Jackson, who we just got off with. We really appreciate the information that was shared. Once I figure out how to get all of this saved correctly and on YouTube, you can go to our YouTube channel and watch it. If you have any suggestions as to who I should talk to next week, please share them. And if you haven't done so already, go to www.bergenincolor.com, join our mailing list, and also complete our 2020 survey so that we can understand the needs of people in this area as far as content is concerned. Do your census. I got mine. I have to do mine. Do your census, because a lot of the issues and programs that are existing now is based on the census from 10 years ago. Things have changed, so we need to make sure that we are counted so that any new programs, any new resources that are become available in the future, we are able to access that in our neighborhood. So again, everybody take care. Thank you for watching, and thank you for hanging in there through all the technical issues, and stay safe. All right, bye-bye.